Hello, and welcome to the Innovation Forum AI podcast, a space where we explore how artificial intelligence is transforming public health. Welcome, everybody. My name is Oliver Morgan, and our guest today is Swapnil Mishra, Assistant Professor at the Saw Seahawk School of Public Health at the National University of Singapore. Swapnil's work focuses on infectious disease modeling and the use of AI to support public health decision-making. He is the Deputy Director of the Center for Epidemic Research and Modeling and the AI for Public Health program, where he works at the interface of epidemiology, data science, and policy. Welcome to the podcast, Swapnil.
Thanks, Oliver, for the introduction. It's a pleasure to be here.
Yeah, it's really great. It's really great to have you on the podcast, and we've been collaborating for a while, and it's really interesting to hear about the work that you do at CERM and AI for Public Health. But maybe you could just give us a quick introduction about the vision for CERM and AI for Public Health and what you guys are working on.
Yep, surely. Thanks, Oliver. So CERM, as it stands for Center for Epidemic Response and Modeling, it's basically our center that focuses on building capabilities around infectious disease modeling, building pipelines, doing our pandemic preparedness. So that's like the work that probably most of the people right now sort of see as what modelers in public health end up doing. But AI for PH is our new initiative within the school, for which actually I'm quite grateful for the school. Why I'm grateful is because we had this special urge in a way coming that whenever people say AI and health, what actually comes up quite a lot is AI for medicine and AI for healthcare. And we wanted to move our conversations back to a place where people talk about population health, where we think about how do you play with large amounts of data, how do you think at community levels. In fact, one of our recent piece where we wrote a comment in Nature Health for a commentary about what it means to be AI for public health. Essentially, we said that this is basically a piece of probably 5 important things. One of them is data structure and interoperability. Then you have got ethics and governance, which I believe probably is the most trickier and the most important bit to get it right, because for most of the healthcare, medicine things have been sorted out, but we really don't know where AI lies, what will happen when we use it for the mass, and what exists in the mass data that could be extracted, right? So if you don't know it, how do you put a governance around is something that's quite tricky. So therefore, we believe that's more important. And then obviously you have got the classic stuff of more model development and evaluation. And again, I think what's more important here is the evaluation that needs to be put in the perspective of like community health, and how you don't think about essentially how you cure people, but you think about how you prevent people and how do you set up those things. And then I think 2 other important things that AI for Public Health program is trying to force around is how do we do workforce capacity, because that's something that will be required. I think as you were touching on it, because everybody's interested in how we're going to be doing it. So how are we going to be moving ahead that we can actually sort of educate people to do this? And then finally, there is equitable implementation, that how do you do it? And I think one of the most important thing, which is the vision for both our programs, when you see combined together, is we are not trying to replace anybody, right? And that replacement is not going to happen. Essentially, what you're going to trying to do is how we can augment it and how we can make AI in a way that it's more useful for most of the people who are using it. So when I look at for myself, I see it as like for a computational epidemiologist or a computational modeler, how you can augment their workflow with AI so that they can spend their time doing something that's more efficient and that allows them to draw more insights. So yep, that's more or less what we are looking into. Just one last bit of thing. Actually, CERM will officially launch on 27th of February. We have our official launch in Singapore. So I will hope that people will get to see more of CERM after that launch. So it would be great to see it there.
Yeah, that's great. Thanks so much, Swapnil. I mean, in talking to you and your colleagues at NUS about the launch, I understand that one of the areas that you're quite interested in is to really go beyond just doing kind of academic studies and thinking about how AI can also be used for routine public health surveillance on an ongoing basis. And you mentioned just now the importance of understanding workflows. I mean, how are you thinking about interacting with public health agencies and helping them understand the opportunities that AI might offer to improve or even expand certain workflows that they already have.
Yeah. So, Oliver, as you have touched it down, that's technically one of the most important aspects that we here at school look into, where it's not about producing papers or like having things out, but actually working with agencies. I think that's something that we do quite good at Singapore, where how do you work with the agencies so that you allow them to function well? And obviously, it's not just them function well, that also reciprocates on us, because that allows us to do work that's quite meaningful and that gives you satisfaction. So one of the things that we have been doing with the things is trying to see that now with the help of AI tools, how we can move a bit of more of modeling or a bit more of analysis into the agencies, right? So this is not, again, coming from the perspective of taking us out. We are still there, we are part of it, but it allows them, once agencies have their own capacities and they can build into more things, it actually allows them to be more effective. So that's one of our more ways to see that on their day-to-day routine tasks what they can do. So few things that we have been able to sort of identify has been that, can we build capacities around nowcasting and forecasting within agencies? That does not mean that like School of Public Health needs to, like, School of Public Health has its own capacity, but it does not mean that Ministry of Health or its corresponding body here, which is CDA, which is Communicable Disease Agency, needs to have a very big need to have a big team. But I think with AI and with few things, you can build those capacities of having nowcasting, forecasting. And this nowcasting, forecasting is of when something is happening around. So like for Singapore, it's about dengue incidents. When things are going into dengue incidents, what can do, and actually Singapore has an example. So my colleague Alex Cook has a model that's used for nowcasting dengue incidents, and it's actually used by the National Environmental Agency, and they run it, right? So Alex developed it, but now it's handed over to them, and they have been doing it, and it has been happening for, I think, more than 8 or 10 years. So that way, like, it's not something new, it's something that's out there. And then I think, as it might sound, actually it's the day-to-day work of an agency that's more important, right? So people might feel like that agencies are more useful when a pandemic happens or when things get triggered. Surely that's where they work overtime, but their day-to-day routine work, which is basically just about how do you assemble a lot of routine data, how do you draw insights from basically your daily data feeds, and what do you make sense of it. Earlier it used to be something that I would say was quite sort of manual, or people had to just rely a lot on looking into things. So that's where again we are working with the agency to see that what all those could be automated, but with a human in the loop, right? So not saying that somebody raises it, the decision making goes to AI. Probably that's not happening that pretty soon. But it's more about that how with the different sources we can work around and do. And then there are a few other daily things that we end up doing, which is at times like thinking about what are the risk stratification and at the population level. Can we come up with fast estimates of those? And can we, again, this comes from the idea of how do you combine various different data sets which are actually lying so much around the ministries, but it's just that people really, if you would do it manually, it will take too much time. So I think that's where it's happening. And then the final bit is essentially trying to see if we can, which is the last bit that we are trying to push, is can we push a bit more of scenario modeling to the agency side? So which is almost like trying to see, rather than every time we running scenarios, is there a way that we can pass them scenarios which could be run by them and evaluated by them and commented by them, so that again, rather than every time everybody waiting for somebody, you at least have the first go of knowing what's going to happen. So those are the things. So in a way, what I'll say is, like, probably if you'll ask me in a one line, I'll say the day-to-day use is not the flashiest use. It's technically the use that's where what you can do best to interpret your data. And that's where I think probably AI is having its highest impact in public health, and especially for the agencies.
I mean, are you finding that the AI component is adding a level of complexity that's difficult for public health agencies to manage? Or do you think that the AI component is going to be an unlock for the data that they already have? And you mentioned that many public health agencies actually already have quite a lot of data, but may be struggling to use it optimally. I mean, where do you see that challenge lying? Is it added complexity, or is it kind of somehow going to simplify the work?
So I believe right now we are in a stage where we all will feel that it's adding complexity. And that actually comes from the fact that we right now, like, which goes back to the thing that we are talking earlier, that we still need to educate the workforce and get the workforce ready there, right? So so this is starting of a new technology or era, right? So this is same as how I would say when the computers came in, right? And typewriters were put aside. So in the earlier phase, it was more about why we need even a computer, right? I can write it on my typewriter. So from that phase we are moving on. But I think with a bit of struggle, which is there with any new thing, we would be at a place that essentially things will become easier. And as you said, like, there's a like we have been losing a lot, right? So by losing, when I say by losing, I mean, I think everywhere throughout the world, a lot of data gets collected, a lot of data gets collected fragmentedly, and that's probably the most like sort of lost opportunity in terms of decision making or getting insights. So I think that's where AI will come and play a very big role. So in long run, I feel AI will help us in there, but yes, we will have some pain in probably in next year or so. But my hope is that now we are catching up. And one advantage that AI has now given is that the newer sort of AI or generative AIs has also made learning also a bit easier, right? So earlier, making people learn machine learning or deep learning was actually a more difficult task. But now the entry, like the barrier to the entry, is quite small, which means people could try things more. And it has also come from efforts by developers also, in a way that now no more everybody thinks about developing a tool that requires like a sophisticated tools. Now people understand that now we have to move towards making simple tools which could be used. And I think that's where you see a lot of great usage of like at least that's my personal belief, that why ChatGPT took off and something nothing else took off was because it came up with something that was easier or more natural for everybody to use rather than being a finished thing. So I think that way, if we see there is that thing. So I think if we can teach people in the long run, we will actually have advantages there.
Yeah, I think you're right. I mean, and I find that I think there continues to be a bit of confusion actually when we're talking about the implementation of AI and learning AI. That I think a lot of people feel quite intimidated by AI because it's inherently complex technology, and really using a whole different set of language about AI, which people in public health are not familiar with. But really, what we're talking about are using AI-powered tools rather than having to understand some of the underlying architecture or technological features of AI exactly. But it's really about rolling out tools that people can use on a day-to-day basis. I mean, how do you think this will translate for decision makers who will, my guess is, not have the time or ability to really get into the tech itself, but will have to interpret the outputs from different types of AI models?
So I think that's the space where I think most of the difficulty right now lies around is. And why I say difficulty is that essentially for decision makers to make a decision, because they have to look across such a large spectrum, that's where they end up feeling scared, or at times that's where they feel like what's happening. Also, I believe at times, at least people call out AI unfairly also, right? Like, okay, to be clear, I'm not one of those who thinks that AI should take over everything. I think we should not, like that's also a false promise. But equally, not everybody understands complicated, even mathematical models, which end up being quite complicated at times, right? So that way, a very big complicated mathematical model is as much as a black box for a decision maker, right? So not for a modeler, but for a decision maker, as a AI tool is, because for them, they don't understand workings. So what that means is, now if you have to give them the outputs, it's the classic thing of the science communication, that you have to start producing outputs in a way that it's useful for the user who's going to be using it. So an output that needs to be used by, for example, Oliver, you, is very different from an output that we need to give to a decision maker who is a policy maker in a country, and they need to be then put the outputs in that space. So I think that will happen. So again, we will learn and people will start to learn. And also, I think I do agree that AI, or the people who have been working with AI, they have not been able to put that much of confidence in people that AI really works. That's also because I still feel we are in a very nascent stage. So where we feel like, yes, it can do many things, but we have not been able to give people that it can do it repetitively and it can do it correctly. So once more and more we start doing this, I think for decision makers, it might end up being the same thing, that you have to, essentially it's more about science communication, whether you produce those outputs in a way that they can use. And then I actually feel they have a better chance with AI, because if you can already see now when the reports gets created, these reports are way more clearer most of the times than the reports that were being produced earlier, and the quality of reports that are being produced are much better, both in terms of what you put in it and how you make them look and how you can sort of emphasize things. So if you look through those spectrums, I think it's almost a net gain for us, with caveats in there.
Yeah, I think you're right. I mean, the ability to produce very useful output using AI is definitely there, and doing it much faster as well. And certainly been my experience that speed matters a lot when it comes to public health decision making, and that actually it's the being able to do things fast enough is actually often the problem more than anything else. Otherwise, you're always behind the decision that needs to be made. I mean, why don't we let's get into some concrete examples and kind of talk through a couple of scenarios or a couple of real world situations where you've been thinking about how to use AI for specific disease programs. I know that you and the team in Singapore work a lot on dengue and trying to understand the dynamics of dengue virus in your part of the world or your region. How could we think about the handoff between, let's say, traditional approaches for understanding dengue surveillance and maybe using some AI to maybe strengthen or supplement that?
That's a good question. I think that's also a great example to walk through people to understand how it can work with, right? So I think the first thing is, you always start simple, right? So I think whatever be the case, whether there's AI, no AI, whether you're in a modeling world, the first principle, I think the Occam's razor principle still stands, that start simple. If a simple thing can answer everything, that's your best answer, right? So in a way, you start very simple. And then you try to start looking into perspective of what's in there that has been your pain point, right? So like, for example, I can say one of the few things that we have been looking into is that when people do surveys on, or when people look about understanding how dengue is happening, essentially people need to go and do surveys home to home, house to house, to understand in what kind of environments people are living in. Now, that's the gold standard. Like if you look at the gold standard has been, you go to somebody's house and you ask them, hey, where do you live? Or you meet people, you ask them where they live, then you ask them whether there is a river nearby, or because you have gone there, you mark that yes, it's near a river. Then if you see a puddle nearby, you mark it saying there is a puddle, and hence so forth, that how many people live and what's the density of the area, whether you live near a like sort of a highway or whether you live somewhere inside, and things like that. Now, if you see all this, obviously this gold standard is quite good, but this is quite time consuming. And if you think about, if you have to do this survey for long, it takes a lot of time. And I think and it takes the time, that's why probably why DHS is something that everybody values a lot, because a lot of people have done it. But then if you try to see where AI could help you, is a lot of these things that you want to do are already available in your satellite tree images, right? You can like now we have very high sort of resolution satellite tree images, which means you can go into a 5 kilometer by kilometer, or a 1 kilometer by 1 kilometer, or even a 500 meter by 500 meter for that, say, tiles, and try to see what's in there, which basically means now it allows you to sort of see whether you are like to see that when you're looking in an area, how much of forest is there, how much of urban land is there, how much of roads are there, what's like, are you living on the edge of a forest, and those things. So again, rather than going out and doing those surveys, that's where I think AI starts to be quite useful. And then for the data for disease, you can actually still go back to your primary healthcare centers or your normal things to just get the numbers in there. So I think that's a very good usage of surveillance for dengue in terms of like you can use remote satellite images. And then I remember this work that came earlier. And again, a lot of this work started earlier. It's not that this is the first time or it's only in last 2-3 years this is happening. Like people have been thinking about these things for last probably 10 years or so. But the speed and the fact that earlier these things could be done by only very few specific people, and now this we have come to a space that it actually from even people who are not probably that much equipped, they can at least start with it, and then they can start to see the outputs and then with the help. So I think that barrier to entry again has become less, has allowed a lot of other people to use when earlier. So the other thing that I know that people have been using, and which again for the dengue has been where people have basically went around like something like a Google Street thing by putting cameras where people have just taken pictures of places, because that allowed people to see where are the puddles, or that allowed to see whether there are broken containers, which are proxy for that. If there is a broken container or if there is a puddle, that's a proxy for that. That's a site for vector breeding, for in this example mosquito here. That then allows people to understand, okay, which areas are probably where we should put more surveillance, or which are the areas where we should be looking more into. So that way, if you see, that's where AI I think is of great use. Apart from like obviously there are a lot of work that's happening in terms of just classic modeling. So for example, earlier people would take data from different sources and they will come up with mathematical models which work well, right? For them technically it works well, but more and more once we wanted to sort of combine 5 or 6 different sources of data to say, hey, we have surveillance data, we have primary healthcare data, we have this data, we have survey data. How do you really combine them together, and how do you find patterns in there? I think that's where AI is something that's where it's making inroads and it's making things easier for most of the people. So that's where AI is playing a role of like combining different data sets together from different places, and then somehow becoming as a proxy for a lot of surveys and stuff by using remote sensing and those kind of things.
Yeah, that's a really great example. And, AI is particularly good at what's called that multimodal data, where you have both numeric data, maybe you also have images, you could also have audio as well. And actually we work with radio broadcasts as well, and you can ingest that and use that as a data source. So I think that's a nice example of being able to look at all sorts of different types of data for dengue and combine that, so you're starting to kind of really augment your routine or traditional surveillance approaches. I mean, how about going even one step further? I mean, you mentioned that there's the option of people to actually take photos, and I guess community members kind of start to contribute data sources. But do you think there's a role of understanding the behavioral dimensions of public health surveillance and being able to add that type of data in and use AI to kind of help us understand those elements of epidemiology?
So actually, Oliver, that's where I think we might end up getting the biggest gain from AI. And by there, I mean, so what you picked up on, which is the behavioral science, because I still feel if you look at across the spectrum of how we have been modeling diseases, people have been able to model a lot of things quite well. But the classic behavior change is something that everybody wants to model, but has not necessarily been able to model a lot, right? And that also comes from because it's not an easy thing to know, right? Like in a way, what you observe is that Swapnil did X. What you don't observe is why Swapnil did it. And but unfortunately, that's the question that we need to answer. Like that's the most important question. So I think that's where I believe that AI will play the biggest role, where it will allow people to model behaviors. And like, for example, an example that I have been sort of focusing of late has been, can our agents being no more just classical agent-based models that people have been using, where you just say that, hey, this is a proxy of Swapnil, who is of this age, who is of this demographics, and the chances of going to Swapnil to office is, let's say, every morning is 80% if it's a weekday, and it's only 20% if it's a weekend. But okay, it's a probability distribution. So he will go on a Monday, but he might not go on a Tuesday, and so forth. But this is still quite static, because this is not necessarily how I take decision. I also take decision on knowing how many of my colleagues are going, whether one of my colleague is ill or not. Like, to be like, I give this example: if there is flu, a lot of us don't really get bothered nowadays, although we should, but we don't get bothered. But if there is flu in our office, if I know that few of my colleagues have flu, I will not go to the office. Right now, that is something that's not there captured in most of the models. And I think that's where you can start to see where large language models which are being built, this being agents, they being given personalities, you can start seeing those behaviors being put into the agents and trying to see how it's evolving. So that behavior. Other thing is, I think what you were touching on was like what I'll call as participatory science, or like citizen science. I think citizen science now have got a greater role to be. Also, I believe, so there are two things. It's not that citizen science is something new. Citizen science has been there for long, but the fact that, as you touched on, that now we have capacity to have multimodal data that might not even be clean, or that might not follow exact things, as like it might not be sort of, how do I say, that everybody is giving the same thing or they're talking about the same thing. So that's where AI actually flourishes a lot. So that's where, if we are able to do, I think citizen science has a thing. Also, I believe there is one advantage of doing citizen science. In a way, yes, it has its biases, but equally you can also say, hey, the data I'm working on is given by people who have allowed me to use it. Like, it's not about, like, people can argue, oh, Swapnil, isn't that's what informed consent is? But I am like, yeah, but in informed consent, you ask them X question and the consent is for question X, and then you ask them a question, will you allow for anything later? They don't know what it is. But in here, you are not using a data, you're asking people to come along and say, donate, and they end up donating different things. So in a way, it's also a way where you might not need data from people who don't want to be identified, or the people who don't want to contribute, but you get data from everybody else who is happy to be there and who is happy to contribute.
Yeah, I think that's a very interesting angle, actually. It reminds me a little bit of a conversation I had recently with Sam Scarpino. He was a guest on the podcast previously, and he really spoke about the importance of very high quality data versus having just large volumes of low quality data. And for the use of AI, having some very high quality data sets are going to be really important. I mean, do you think that there's an opportunity with your new center to help capture some of those high quality data sets, or generate some of those high quality data sets, and start focusing on, let's say, filling in some of those gaps in our knowledge for infectious disease modeling, the types of epidemic dynamics that you were mentioning, which at the moment we kind of average across because either we don't have the data or it's too difficult for us to actually work and analyze with those data. Is that something that you think your center may be able to focus on?
That's one of the things that we like when we were starting up. And like, okay, so in a way, I'll also try to say that, okay, center has been there for long, but we officially start, and we were hoping that these are the kind of things that we could do and which would make it. So I think the point that Sam made is quite important one, but equally, I believe that's where, if you look at public health, is quite sort of well placed. Not necessarily everywhere. Obviously, we still have challenges in many countries where the public health agencies are not built to the ability that they should be, and it's not their fault. It's because of the way in environment they are, and it's because of the opportunities that they have. But at many places, actually, public health agencies have got good data sets, or at least data sets that are more representative of many things than the data sets that exist for any other thing. So in a way, I feel we might not. So I think public health has that. In a way, public health is in the space where we don't necessarily have large data sets, or we have too many things, but what we have is small data sets, which are high quality data sets. Now, for our center, for in specific, I think being in Singapore gives us that advantage quite a lot, like in a way that being in a high income country that has got resources at its disposal, it allows us to have quite high quality data sets. And equally, it also allows us to have access to various different data sets, which I don't believe exist in many other places that easily, right? So therefore, one of those things is what our center is right now focusing on. That can we start sort of combining data sets from different agencies together. So like, for example, can we start to combine data from land transport agencies? So in a way, you are looking at mobility of people. Then you start combining data from what I'll call as the urban design, like the urban planning agency. You combine those things to know where people are living, how the how the new plants are being developed, and then you combine it with the Ministry of Health, the National Environmental Agency data set. Once they all come into together, that's where I think our center is trying to play a role of that we can do. And what gets added more in probably in Singapore setting is that we are also able to get a lot of passively collected mobile data sets, right? So which allows us to sort of understand how, where people are moving in, right? So that sort of allows you to have the latent understanding of that, okay, people go from X kind of people go from here to here, and how they are moving, when they are moving. Are there some things with those people that's different than the other people? Like, for example, is there a difference among people who are going from a hospital to a public park? Are they different from the people who go from a school to public park or from a workplace to public park, and what's driving? So yes, those are the insights. And again, that's where I think AI also ends up, because if we wouldn't have been using AI, if we go with our classic versions, we had to come up with a lot of hypotheses, and we had to come up with a lot of sort of what I'll say as uh, a lot of mechanisms that we would have thought is driving people. But that's not necessarily true, because we might think X, but X might not be true. So I think that's where AI will allow us to sort of chunk through this large sets of, like, this large portions of data sets, and find patterns that might not be that easily comprehensible if we would be using classic techniques. So yeah, that's one of the sort of the our forefront aims to see that how now. So like, for example, I can give you an example. So contact matrices have been developed, and they have been, so for example, for people who don't know, contact matrices are these matrices that say a person of age X, what's their chance of meeting another person of age Y, and how this distribution differs for people for different ages, for different genders, and many other dimensions. If you want, you can put this. Classically, we have been doing it with only essentially survey data, which again is the gold standard, but it has, as I said, like, it just takes too much time to collect those data and things. So like at center, we have been now building towards to see whether we can take these new data sources like GPS signals, satellite images, and all of them getting combined together, and like also tap in tap outs of people using their metro lines or bus services, to see that whether we can use those data sets to create a proxy for this, which then will allow a lot of other countries to actually build on, like, because that will then not mean that everybody needs to do a survey and things like that. So those are the things that, yes, at our center right now is at forefront of.
Yeah, I think there's a really big opportunity there to really explore these leading edge cases where the technology now, the AI technology now is becoming available, but not everywhere, as you mentioned, have the data sets compiled in a way that they can use them with the new AI tools. So I think the work that you are planning to do at the center in Singapore is going to be very instructive for others, other countries, other centers who are also looking at doing similar type of work with AI tools, and to really explore what's possible for public health. I think there's a lot of exploration that's still to be done, and for us to understand how we can move forwards in the public health world with all of these contemporary tools that we've got at our disposal. Maybe we can just kind of come to, full circle a little bit. We've spoken about some of the opportunities for collecting different sets of data, engaging communities maybe in even providing those data or being part of those data collection and surveillance mechanisms. And we did touch on briefly the challenge of working with decision makers who ultimately are going to have to interpret all of this information and make sense of it, at least from a decision-making and policy-making perspective. Where do we start with this? Do we I guess it's not business as usual. We can't just present the outputs of the more sophisticated analyses using AI. We must kind of walk the decision makers through it. From your center's perspective, how are you going to engage with decision makers?
So I feel there are sort of different layers of thinking about how we should do it, right? And so I think, first of all, just realizing that the workforce gap is the real bottleneck, right? So I believe the first thing that we'll all have to realize is that, yes, AI is making inroads. There are big things that's happening, but and there is a workforce gap on both sides. AI for general purpose is being built, but do we have AI that can account for the questions that public health requires? Like, I think there is a gap in there in just of people who can develop those technologies. And obviously there's a workforce gap of people who can then use tools, as we were talking about right now. So I think that's the first thing that we would be looking from our center's perspective to think about, that how we can, and this is from not just CERM, this is for our AI for public health program also, to see how we can try to start a system where we can educate people and then make them what I'll say as AI public health literates, right? So that they sort of know which tools exist and those things. In fact, for that, we are also right now in planning of thinking that whether we should come up with a new sort of course or a new degree that actually is just around analytics, AI, and modeling together, and where there's a heavy usage of AI. And this is not necessarily, as you touched earlier, trying to teach people like the nitty gritties of technology, but this is about trying to teach them how to best utilize this, right? Like, for example, I keep saying to people that, yes, your large language models nowadays can do a lot of things, but getting the right information from them such that you can trust that information is still an art, and that art needs to be taught to people. Like the same question being asked by somebody who does not know how to ask the question. But again, that's the classic thing, right? Like if you think about who is the best reporter, every reporter has got a chance to get a news, but the best reporter is the reporter who knows how to ask the question and when to ask and where to ask and how to lead the person to give that answer. So I think it's the same with the AI in a way, how you ask it, when you ask it, and how you lead AI to the real question rather directly. So I think that's the first thing. Other thing which I think you did touch, which was about trying to make people understand that it's not about algorithms. It's right now, it's really about data infrastructure and building in data infrastructure. So what we have to really do is concentrate a lot on creating big data infrastructure. So if you don't have data infrastructure, you might not be able to use AI to the fullest. So I think that's something that needs to come. And once those things are there, I think that's when I believe we would be able to get our sort of decision makers to sort of trust a bit more of those things. And then again, I think we'll go back to the last thing, which is like, you can't just give them an output from AI. That's useless for them. You have to still make sure that the output, the way it's created, is done in a way that it aligns with the kind of information they were looking at. And in fact, I believe that is something, if you start using AI could be quite useful for that. Like, it allows you to structure information, it allows you to decimate information in quite much bigger ways and much better ways that way. So I think that's one of the things that we are looking into, see that essentially we are looking at very simple things right now at centers, which is like, okay, I have got my preliminary report ready with me. At times just checking with the AI to say, hey, this is what I wanted to put in my report, these are the messages we wanted to put out before going to minister. Do you think that our report has those things? Can you critically evaluate that whether we are giving the right set of messaging tone? And it allows you to sort of have an assistant with you who is always questioning you, right? So that way it's a good tool most of the times to how you go around and talk to them. So I think those are the things that we are doing right now.
Yeah, well, it's a fascinating approach, and I think it'll be really great to see how the work of your center develops over time. You said you're launching on the 27th of February. Where can listeners find out more about the center? Presumably you have some presence online, and there'll be more information about the work of the center coming out.
We will, so right now most of the information is on our LinkedIn pages, where we have talked about that, where people can also register. So people who happen to be in Singapore or traveling to Singapore, they can register. So it's free for public. So it's not like it's not a closed door event. So that's the first place. Right now we have got the LinkedIn advertisements out. The day we get the center out, we will essentially also start having our website out there and being used so that people can look for some and get the thing. So it's still a work in progress. I believe before 27th it should be out, and hopefully that will allow people to get more news of. And then we are actually still seeing that. There are a few requirements on the sides of people who are coming in a way to see, but we are still seeing a possibility whether we can have a live event which people can join at least for a small period of time on Zoom or something. But that's something that has not been finally approved by the place where we are having it. So that's that I cannot certain. But I think if that's there, do look out for like a LinkedIn announcement from me or from the school with those details.
Great. Well, thanks so much, Swapnil. We'll put some links and some information in the show notes for this episode so listeners can go and find out more about the center and the school in general. And we'll keep an eye out for the work that you and your colleagues will no doubt be publishing in due course. And we wish you all the very best with your endeavors and actually look forward to learning a lot from you as well.
Thanks a lot, Oliver. It was pleasure. It's always a pleasure talking to you and discussing things.
Thanks so much for joining us for this episode. We hope you enjoyed it as much as we enjoyed making it. Be sure to subscribe and share this podcast with your friends and colleagues. We'll see you next time.
The Innovation Forum AI podcast is produced by Zoila Leiva Rioja and brought to you by the WHO Hub for Pandemic and Epidemic Intelligence. We'd love to hear your feedback and ideas. Reach us at pandemichub@who.int.